I'd like to introduce Connie White Delaney. I'd like to say some words about her because I was amazed. I think I first met Connie maybe 2015 or something like that. I was amazed at what you've done, and so I intend to embarrass you a little bit, but inform the audience how lucky we are to have you. So after a bachelor's in nursing and mathematics, she got her M.A. University of Iowa in nursing, Ph.D. University of Iowa. Her major was education, administration, computer applications, and then a postdoc at University of Utah. Dean Delaney, Dean of the Nursing School, is the first fellow in the College of Medical Informatics to serve as a Dean of Nursing. She was an inaugural appointee to the U.S. Health Information Technology Policy Committee, Office of the National Coordinator, and Office of the Secretary for the U.S. Department of Health and Human Services. She's an active researcher in data and information technology standards for nursing, healthcare, interprofessional practice and education, big data science, and integrative informatics. She serves on a large number of health, business, and industry and policy boards and advisory committees. And if I were to list all her awards, I would eat further into her time to be on the podium. I remember meeting her at about 2015, I think at a conference, and chatted and said, well, can we talk? And went to her office, and I was totally amazed that we were talking the same language and about innovation and how nurses play such a very important role in innovation. Also, I found out that the same design firm that designed the Bakken Medical Devices Center, BWBR, from St. Paul, had designed their space. It's a wonderful space. You need to visit. So it's just right across the street. Was it third floor? Fourth floor. You need to visit that space. It is totally amazing, and maybe she'll say something about that. I asked a colleague in the Bakken Medical Devices Center what would you say if you were introducing Connie? So here's what he said. Her passion for rounding out experiences for nurses is demonstrated by her vision to help them recognize their unparalleled opportunity to improve patient care through understanding medical device innovation. I couldn't say it better, so that's why I quoted him. She invited both her staff and the Bakken to put together a one-day conference, which I think was in about 2016, Planting the Seeds of Innovation Conference. And that was born then and run since. And the first year, about 100 nurses came. Following this, then these experiences continued, and the nurses had an opportunity to do prototyping, invention, and also explore testing in the field. And then since we've had two of the nursing graduates be fellows in the program. So I'm really, really excited to hear what Connie says. So please welcome with me, Connie.
Thank you, Art.
Thank you.
Thank you. Good morning. Delighted to be here, and Art, thank you for those comments. And what I'd like to say is that in the 17th year at the University of Minnesota, I've never had 2 days the same, and they are filled with as much excitement and possibilities for innovation today as they were when I first arrived here in Minnesota. The phenomenal relationships across this university, and I particularly want to lift up the Device Center and also the College of Science and Engineering, is just phenomenal. Two other comments. One is that, thanks for highlighting the seeds of innovation. I'll make a couple comments, Art, about that. And my major comment is, maybe like you, I came here to be invisible. And what that means is we're all about the people we serve and making their lives better in terms of true whole health. Not only the individuals, but families, communities, and the public. And I only have one invitation for today. That is asking you to welcome the breadth of numbers, local to global, where nursing and nurses are. And as Art and I were talking, you know, I frequently refer to it as the biggest gold mine that you have at your fingertips. And gold mine means possibilities for innovation and making change with phenomenal partners. So with that in mind, I invite you to just taste the breadth of nursing. Presentation is divided into two parts. One is what the numbers and the span of nursing look like. And the bottom line is they're literally everywhere. And nursing's literally everywhere. And the second part, that flow, then a few examples, and then I'd just like to conclude with how we stay in the fullest connection, if you might say, of head and heart. So, thank you for the invitation. Yeah. So, it really is about the Vista of digital health initiatives through the human pulse of nursing. When I went into medical informatics, the theme that I always kept in my head and my heart was that informatics is literally the soul of technology. It brings the people and the experience, the data information, knowledge, and wisdom to the table. So I'd like to start with just a few comments about, and I've asked, by the way, the slides be available. I put a lot on slides. They're meant to be referenced. I won't talk about most of it. But two anchors, I think, are internationally, what is nursing anyway? And from the International Council of Nurses in Geneva, our international body, it is autonomous and collaborative care of individuals of all ages, including pre-birth, families, groups, and communities, sick or well, in all settings. Where people are, nursing is. And it is about the promotion of health, prevention of illness, and care of the ill, disabled, and dying people. And here in the United States, the American Association likewise has American Nurses Association also has a definition, and you'll see that it reflects the international as well. Protection, promotion, and optimization of health and abilities, preventing illness and injury, facilitating healing, and also getting into our role in complementing physicians and other healthcare professionals in how it is that we deal with illness conditions and the responses, and advocacy, and we do include communities and populations. So it's the breadth. And the breadth extends into massive settings. So I've listed just examples, 2 columns of examples. The take home there is, yes, they're in acute care, but they're in schools, they're in home health, they're all over corporations, in corporations, education, military, et cetera. And the real bottom line is that nursing serves across the care continuum. And you can see in this diagram all the way from staying healthy, getting better, and then living with chronic illness and disability, and of course coping with end of life. So the breadth of nursing in terms of service is expansive. A quick global and US picture of what the numbers look like. There are 27 million men and women globally in nursing. So they represent 50% of the global health force. WHO estimates, key point here, that we need an additional 9 million just 7 years from now. And you're going to see that reflected in the US stats as well. In the US, we're the nation's largest healthcare profession, 4.2 million, and 84% of those are employed in nursing. You'll see nurses all over, and they'll be in other types of professions and environments. That's why I include that stat. And then here, the federal government is projecting that we need over 200,000 new positions each year between 2021 and 2031. So I apologize for not being at this conference on Monday and Tuesday. The Minnesota Hospital Association had a conference. It was on this fact. So these national statistics are represented right here in our state, and dire growth. So when you scope this out to the international level, local to international, our School of Nursing, the University of Minnesota, like environments from where many of you come, are committed to the 17 UN WHO Sustainable Development Goals. Most of us in healthcare focus on number 3 because that's what it says, health and wellness. But when you get into every one of the other 16, they all have a relationship to health, and they definitely have a relationship to nursing. And a couple comments about this school that exists here. It was founded by a phenomenal gentleman who taught and studied physiology, Richard Olding Beard. And he brought to the medical school, the rest of the university, the Board of Regents, this idea of creating a nursing program. So this program is the first program in the world that was birthed in a university. Others were birthed in hospitals, schools of nursing, that sort of thing. And they're great. Most of them have transitioned now to university and collegiate settings. Why I bring that up is Art, you talked about, kind of being here in the middle of the Midwest sort of situation in the United States, in this globe. There's an energy here that is quite phenomenal. And one example is no pre-existing sort of examples. We're going to create nursing in this university because it is a science-based profession. That's the message, knowledge-based. The other reason I put this up, oh, by the way, we're planning for a birthday next year, 115 years. And the other reason I wanted to share this slide is Richard Olding Beard, there were 3 constructs that underpinned the creation of this school. Its key role in preserving the worth of human life, conserving human life, and providing for social justice. So those still constructs, the 3 constructs, are as alive today as they were back then. And Gary, if it works, just a 1-minute video that gives just a quick peek of professors in the School of Nursing talking about research.
We know individuals come to us with a lot of assets, and how do we leverage those to help them improve their health?
My hope is to really empower children and families to make their lives as healthy as they can.
I really hope our research will help reduce the number of people who eventually have Alzheimer's disease.
I'm particularly interested in how nurses reason about complex situations.
I hope that my work impacts people through the ability to develop better policy that actually represents the consumer of healthcare's voice.
My research really looks at the underserved communities, our immigrant and refugee communities.
I hope that my research both improves health and health services for young people. I want my students to be aware of the disparities in healthcare, of the barriers to healthcare access or healthcare positive outcomes, and work with the patient to change those things that are getting in the way of good health.
Nursing research
Has the potential to
Transform healthcare.
Transform lives.
Improve population health.
Change the world.
Make life better for everyone.
transform the United States healthcare system.
Dynamically change and adapt the way that we think about healthcare today.
Generate knowledge to improve the health of all people.
Nursing research is really looking at the factors that cause health problems and not just the health problem itself.
We're doing things that are directly impacting patients' lives every day.
Nursing research is applicable, it's relevant, it's something worth investing both time and energy and resources into.
Nursing research has the capacity to change people's lives.
So, Art, you mentioned the Seeds of Innovation. That was launched in 2016. We had a 3-year break during the COVID situation, and we're relaunching that in 2024. That was about bringing nurses together to have a more active role in partnering with all of you, from concept to the actual inventing, transforming products, and you know also they use most of your products, no matter what setting they're in. So, in fact, it was also about bringing to light and transparency what are called workarounds. So no matter what environment you're in, particularly, I'm going to say in acute care, nurses do massive number of workarounds every day, and those are the keys to, one, new idea for an invention, second, what needs to be corrected with the devices they're already using. So this was about creating blueprint about how nurses think creatively, identify target markets, developing the value proposition test, and evaluate ideas. So in that very first conference, and you might remember, Art, we did a 1-hour table exercise of these 100 people. And in that 1 hour, they generated over 600 ideas of innovations that relate to devices and other transformations. And so if you want more examples of these, I've put a link in this set of slides. There are several things that have grown out of that, one of which, one of the graduates of the Doctor of Nursing Practice program here, Oriana, was named the Vice President at the national level of the American Nurses Association enterprise that's devoted to nursing innovation. The key part here, again, that I want to share her quote, nurses are the ones who tie healthcare teams together and naturally act as the bridge between the complexity of medical and the science world and the human experience. That captures what it's about, and again, feel free to contact Oriana anytime you want. The next few slides just highlight few examples of the dance of nursing people, what they've created, and it spans the babies to older life. It spans inside the body to outside the body. It spans families, communities, and global. So you'll just see Anne McKechnie here on the left. Anne's all about these little babies that are in vitro, and they know that they have massive cardiac issues before they're born. What does that mean for not only the baby and how we sustain, but also the family? So she has a host of research and patents in the area of supportive devices and processes to help these people. So it's about, she really focuses in cardiac congenital heart disease. Donna Bliss is interesting on the far end of the situation. We have a lot of GIS work going on in the school. Donna has had a number of patents in terms of wearable health simulator, bariatric mannequin simulation system, and most recently, she has married GIS to the massive hiking trails in the state of Minnesota. Frankly, how do you go to the bathroom? So she has linked all of this up in a phenomenal app that's been adopted by the state of Minnesota. And Amy, you talked about, Amy was your first one, Art. Amy is also a Doctor of Nursing Practice grad. She is all about healthcare design and innovation. She was the first school grad that became the Early Bakken Medical Device Center Innovation Fellows Program in that. And she says, innovation, it turns out, is nothing new in nursing. It is the life of nursing since forever. What nurses do is they see a patient need, they create something to fix it or deal with it. They have this rich history of being innovators that she didn't know about, and most of it is invisible to all of us. The idea is, to, in my comments, to make it more visible. A couple other examples. Qilin Qi is artificial intelligence, large database research. You can, we have a partnership with Optum Labs. We're the only nursing school in that initial 7-partner base, including Mayo, and now there are transformations of the Optum Labs within the United Health Group. So we have access to this huge database, 200 million people. That's both public data and private data, private meaning payer. Qilin focuses on precision medicine. He's particularly focusing on statins right now. Art mentioned the Big Data Conference. So we are in our 11th year of that, and we're known as the Big Data Hub for nursing in the United States. Massive access to large databases, some of which are located right here. And the reason that I picked Cyrus Bethesda, to be an example here, is he does massively wonderful work in social determinants of health, so you immediately know, marrying all these disparate databases to solve really critical issues in our healthcare system. Couple more, Jenna Marquardt, in her second year here, professor that came from Massachusetts, her focuses in industrial engineering, but Jenna is all about design and testing technologies that support precision health. And you can see the engaging of the consumer nurse, physician, the decision making, and she's focusing on older adults in a number of these areas we talked about before. Disease condition or the experiences of everyday life, sleep, fatigue, heart failure and such. Martin Milikowski is another wonderful partner and in the university and in our school. All about, again, advanced artificial intelligence methods, both locally and does outstanding work coalescing people at the international level in nursing AI. Cindy Bradley focuses on virtual reality, simulations, how we reach out to the full state of Minnesota with the simulations that we have, but conducting it all in the Benson Center, Innovation Center that Art highlighted before. Couple other comments. We are pathetic on robots. We want to be engaged. I want a robot with me throughout the day. That's from an administrative perspective. We need them in the Benson Healthy Community Innovation Lab. And the reason that I put it here is, this is Connie opinion, that in the United States, as I travel in Asia, travel in Europe, the deployment of robots, particularly in assisted living, care of older adults, is just profound. And yet we have some sort of situations to overcome in the US to be open to it. It is phenomenal to see elderly persons, if you will, bond to their robot. And so we need your help, and we want to work with you to overcome whatever the stigma is in the United States that human beings are not diminished. Also mention Robin Austin and her full team. These are just examples. Mobile app, My Strengths, My Health. So these are examples too that bring us more into the fullness of whole person health and mental well-being. I want to make a comment here. As I've quickly gone through these, you might think all these people are nurses. They aren't. Part of our faculty in the School of Nursing are computer scientists, engineers, etc. But we're all about nursing. Some of us have a license. I wanted to highlight, there are several examples of these type of control centers in the United States, but there's a particularly phenomenal one here in the cities, the Nurse Run Mission Control Center, mHealth Fairview, phenomenal. This brings data to a whole nother level. A big challenge there is getting it now out to encompass not only the acute care system components, but all of the clinics and out into the communities. So those are a few examples. Now I want to share, I'm going to call communities that are available to you to engage in new ideas, innovation, or common goals, testing, and really being co-creators with you in devices. So there's a national initiative that started in 2015. It was a partnership between the American Association of Colleges of Nursing. There are 800, almost 900 baccalaureate and higher degree programs that are members of AACN. And they partnered with the American Organization of Leaders in Nursing and said we need the academic practice partnership more clearly defined, and we need to grow them. So we became one of those first academic practice enterprise, academic practice collaborations, and in our school we call them collaboratories. And 2 years later we won the national award for all the accomplishments with our partnership with mHealth Fairview in nursing. And I want to make a comment, because some of those of you that are local know that there have been kind of waves like this related to the university relationship with mHealth Fairview. All of this happened during one of those waves when they were kind of working out how they would work together. And in nursing we said, well, that's fine, it's nice to have that worked out, but in the interim, we're just going to continue working together. So I share that as a conveyance of the value system from which we work. We have since grown 7 more collaboratories. You see them listed here. Children's Minnesota, Essential Health, 4-state region in the northern part, Faith Community Network throughout the Minnesota, of course the VA, long time relationship, Prairie Care, all about mental health, the Minnesota Hospital Association and Mayo Clinic. And when you do a quick look at that, for those of you that are here from Minnesota, you'd go, just a second here. Some of these entities are kind of like competitors. We don't pay attention to that in the school. By that I mean, yes, we know, yes, we're sensitive, but partnership and collaboration override competition. We're looking at those common threads that all of us contribute to, and that's going very, very well. These are resources for you. We created in the second 2 years of COVID something called the Coalition for Nursing Equity and Excellence in the state of Minnesota. It's reimagining nursing education. We can't do it alone. We partner with all health systems in the state of Minnesota, including Minnesota Hospital Association. And we're trying to tackle the dire situation in this state that crosses all health systems. And you know what it is. We have inequities, racial, ethnic, et cetera, a retirement cliff, education enrollment shortfalls, huge nursing shortage, and this issue of full-time transitions to part-time, et cetera. This graph, when you get a chance to look at it more closely, you'll see what this situation looks like. We're optimistic. And we know, just like in medical device, that we have to work together in order to bringing all of us, mind, actual activity, and the variety of resources together to address this in this state. So we made an agreement to work together. The overall model looks like this. It has 4 key pillars. Some of these might resonate with areas that you're interested in process or other products. The workforce, that'll massively change. We'll do it in partnership with, as I mentioned, health systems. Workforce inequity and how we bring the massive diversity that already exists in Minnesota into partnering with us. Simulation and experiential learning, and then of course how we support nursing success. So a comment here is that when you have your ideas, whether they're inside the body, they're on the surface of the body, they're sensors, clothing, how it is that we connect people and communities together to do this sort of work, this is the invitation that we want to extend to you. There are all these people working together, the relationship's there, and they say yes. You might wonder what the stakeholders look like. Here's just a few of them. We have 60 to 80 stakeholders throughout the state of Minnesota. So it's not just health systems, it's every school of nursing, public and private. And by the way, this was birthed with the chancellor at the university, the president at the University of Minnesota, Joan Gable, in partnership with the chancellor at Minnesota State University, the 2 public systems. For the first time ever, we got together in healthcare and said, we will work together on this. And there are many other stakeholders, as you can see, including the 11 tribal nations in the state of Minnesota, industry, et cetera. So this is just a sampling of that. And then I want to whip back out to the international level. So back a few months ago, our school became the first school in the world to be awarded or recognized as an associate member status of United Nations NGO. So the non-governmental organizations, it's a consultative relationship, and we celebrate that and held our first, through that mechanism, the innovative approaches to informatics and big data just a few weeks ago through that mechanism. So again, we have a pathway that if it fits what you want to do, we have a pathway all the way to the United Nations in terms of input or dissemination, all of those areas. Now on a more kind of like, I'll say, everyday functional level, we know there are a host of these technologies that are transforming patient care. Most of these do traverse acute care out into community and beyond. I was reviewing particularly last year's conference, and I need to say that in nursing, we do focus on individuals. We go all the way to population health, global health, and we were the first school in the nation to appoint a director of planetary health. And the need for work that many of you are already doing in climate and all of that. There is so much, but there's so much more specifically in the health area. So a number of these apps, what about what happens in homes? And you know the massive transition to enabling people to basically stay in their homes, all the way from ICUs, from little tiny, preterm infants to older adults. Massive opportunity. I want to acknowledge the factors that contribute to errors associated with medical devices. We could spend a whole day or a whole conference on that, and I don't want to do that. I want to acknowledge it and share that in partnerships we can prevent a number of the error-associated contexts that create this. We want to offer that nursing is one of the keys in making these devices the most usable and, if you might say, error-proof. That's just about the device. A host that you already know of the world you live in, and we live in, are all these organizational, environmental, and device user characteristics. And we're part of the solution to handling that. This is just one model that illustrates the complexity that we reflect on. So this is my final slide. How's the time, Art? Time is okay? So this is my final slide to extend the invitation to you based on just a few examples of numbers, local to international, a few examples of the breadth of the areas of device, et cetera, and innovation that we're in. Extend the invitation to you that nursing is here to partner, whether it's right here, it's ANA in the Innovation Center, all the way to the global environment. We're here, and that being here means tap the hundreds and thousands of ideas that we already have on what could be made better or what we really need. And that's a whole conversation. Nurses touch all people, families, community populations, and planetary health. We're local to global. And I particularly want to comment on Matthew Cooper's comment. He had a magnificent speech last year. And I hope that you take time to re-listen to it. One of the most phenomenal things about his talk, as well as others that have been here and I see will be here today, is this business about how we marry not only our technical expertise, I'm like that, medical and health informatics, how I marry that expertise to the breadth of who we are as human beings. I call that connecting head and heart all the time. And I want to make a comment that you'll notice when Art introduced me. Yes, there's computer application, there's mathematics, computer applications, medical informatics, and all that. But actually, a couple years ago, I went to school here. I became a student in integrative health and healing. And I did that to more formally complete the circle in my own knowledge on who we are as human beings and how we're all interconnected, inside ourselves as with others. So anyway, Matthew had a fascinating comment of many that he shared last year. And he said, you know, the most important part is the 6 inches between our ears, from one ear to the other, you know, our brains. And I want to add to Matthew's comment, and the 6 inches that connects each of my ears to this, my heart. And when we can keep that sort of triad synergy together as we develop devices, as I mentioned to Art, I think that we're just sitting on a massive gold mine in working together. So I'd like to conclude by, again, we're about closing the loop on technologies, our discipline, and our full partnership with the people. And with that, I invite you to listen and watch this video that is an international video, again produced by the International Council of Nurses, to capture what nursing is like even when all the technology is wrapped around our people, whether in the ICU or the community.
Step and day by day, in your days of hope and glory, in your nights of doubt. teach you how to live and stand tall again. Body and soul is my vocation. I have chosen my profession. Here I am, I'll be the guiding light you need. I will be there even when the sun goes down. No loneliness, no fear when I am close to you. I will be there forever by your side. Leave sadness behind, and I will take care of you. I will give my life as long as you're in need. Rain or shine, you can always count on me. I will soothe your soaring heartache. I will calm your every fear. I will be your strength till you are well again. Now look at me, I stand by your side. With love and care, with science and knowledge. I've studied long, hard years with no rest. Give you the very best, and I will take care of you. I will be there even when the sun goes down. No loneliness, no fear when I am close to you. I will be there forever by your side. Leave sadness behind, and I will take care of you. I will be there. I will be there. And I will take care of you.
Thank you, Gary. Thank you. I know that had a lot of soft in it. But you know, our ability to use the devices and the sensors, et cetera, that you're developing is a wonderful opportunity to bring together the more, if you might say, concrete with the soft and actually measure it. I thank you. I don't know if there's time for questions, Art.
Well, that was just wonderful. You remind us, Connie, as academics and as students, we're going this way, right? Mm-hmm. More importantly, going the 6 inches this way, so thank you so much. We do have time for questions, and we have, yes. Thank you, Terry.
Thank you for your talk. I wonder if the nursing school is also involved in our new product design course. Do we get faculty members from the nursing school that participate in the new product design? Because I would say that it would be vastly helpful to understand the caregiver's side of that equation. I'll give you an example. So I work for Medtronic. We have temporary pacing, and we will go and ask surgeons, are there things that we can do in temporary pacing that improve the device? And they're like, it works pretty good. And then we'll get to talk to ICU nurses, and you'll see like that morning was a hot mess of everything going wrong. And you get two different sides of the caregiver equation, and it would be really great to have that perspective from the faculty as our students and industry are looking at new options and features.
Mm-hmm. Thank you for your question. You have several key points in that description. One of them, I'm going to try to capture several of them. One is our faculty involved. So here at the University of Minnesota, we are deeply involved with Andrew in the College of Science and Engineering and want even more engagement. So the thirst is there. It's a matter of how fast we can keep moving. And that is also my way of saying that, and then we have a certificate program with the College of Design on processes, makerspace, you know, clothing, sensors, da-da-da-da-da. And again, that is also an area to just grow, grow, grow. Next, Mayo has instituted an internal program that relates nurses and engineers together. We have that going here in academic, in our environment here. I want to grow it as fast as we can. Third, we're incorporating design, et cetera, into some of our programs, particularly the Doctor of Nursing Practice. My next comment is, that's, you know, each discipline brings the strength to the picture. And we've had a number of relationships with Medtronic, and I want to thank you. And so it's a both and. There's a difference between what works in the maximum capacity, in this case, say with say a pacemaker, and what it's really like when, what nursing brings is that pulse right on that person, whether it's in an ICU or when they get home, and what works. And then I want to make another comment again. The plea is, so many times, if nurses are brought to the table, they're brought after it's been designed and it's kind of like out there. But you know, if we can back it up, so much time and, if I'm going to say trial and error, could have been avoided because nursing knows what's happening with that person in their actual, really lived life, whether it's in that bed or whether it's in their home. And they also know what it's like from a nursing perspective to deal with it. You'll notice in that video, there was some form of technology in almost every one of those pictures. And you'll probably first notice it was in the background. That's a nursing job to, I'm an ICU nurse, by the way. My job is, I'm tending to massive technology. My job is putting it in the background of those patients and the families as they come in. So we can help do that. And part of that is being on the front end. And I'm going to use this opportunity, it's a soapbox comment. Being an ICU nurse, you know what that massive situation is. If you just look at infusions, can you imagine dealing with that day in, day out, and the potential for error? So I don't know what the solution is, you all do, to get this simplified so some of these complex, like this, pictures we're seeing can be simplified. And I know there are solutions for that, and that gets our errors down. I think I covered, so the invitation is, the reason that also I shared, whether it's this university, the 7 collaboratories that are in this state, the coalition that's in this state, or if you want to go national and international, these groups are there and ready for you. Yeah.
Hopefully other people have questions as a follow-up to what Terry mentioned. Maybe you can brag about your innovation space and the ability for teams to come in and companies large and small to come in and have that voice of the customer right away.
Yes, thanks, Art. I'll make a comment about the Benson Healthy Communities Innovation Center. So what that's about is this vision that we needed, if you will, a mini health system environment. Whether you're in assisted living, whether you're in ICU, operating room, or you know, a typical, I don't know if typical is a word anymore for this, but acute care bed or out in a home environment. So we simulate those environments, but what's most significant about it, and I would say we're kind of on the lower end, when our nurse anesthesia students, we partner with medicine when we get into the deep, really high-tech stuff. We have some in this center. But what it also allows for is partnerships with industry that want to come in and do experiments on early models, and it really focuses on processes. And that's another area that I know might not seem as cool, but the support mechanisms and innovations that we need to support safe processes is unbelievable. And it's not just another, where the nurse, I know I'm going a little bit away from the Benson Center, but you know, where you have 6 different devices, you know, like you're going into combat or something, and none of them talking to each other. And you already know as well that in the AHR, which has been the priority area in my life, the talking and being able to integrate all types of data it has so much potential. Yeah, it's really bare. Yep.
We have a question over here, too.
Yeah.
Thank you. And others, please. We have plenty of time for Q&A.
Hi, wonderful talk. Thank you. I was wondering what some of the practical solutions could be for getting ideas from working nurses, like some sort of suggestion box in the in the nurses' lounge. You know, how do we tap into those ideas and suggestions?
Yeah, thank you. And I'm going to mention 3. One is a suggestion box. The likelihood of getting that right now is quite slim, just because of the intensity of what all these environments are like. Second, when we do the 2024 Seeds of Innovation, we will come back to that, because giving people time to sit there and actually take time. They have these ideas from their everyday experience. So that to generate over 600 ideas in 1 hour, now that's productive time. Not all of them were viable, but to get that much volume to be able to consider. And then the third thing that I want to say is there's a whole set. I'm going to just use us as an example, but there are 300 of these programs across the U.S. On the Doctorate of Nursing practice programs, we have the largest program in the nation right here. So those are people that have already been in practice. They're back to get this, you would think, a practice doctorate. It's all about translation of science into practice, et cetera. And they're sitting right there filled with ideas. So tapping into that group of people within the different schools and colleges like ours, and we can partner with you and make that happen. So you see kind of a thread in what I'm saying. I didn't say send a questionnaire out, a survey. I didn't say that stuff. Talk. And then my last comment is, how, you know this better than I do, how do we get people to recognize that every time they are creating a workaround to a situation, that's an opportunity for innovation? And so that's one of the key things that we do in the collaboratory. How do we, across these thousands of nurses that are employed in these 8 collaboratories, for example, know that when you just did that, that could be a gem and an innovation, so capture it. This happens in any given hour, in any healthcare setting you're in. Creating these workarounds is a natural, almost automatic response of nursing, because they're on the patient. How do I get the job done? And they don't often recognize that that thought could create an innovation. Share it so other people can help develop it out. So those would be my 5 ideas right now. Go to the people and hear the short stories. Yeah. And you know, this is a kind of a miss. I was focused so much on kind of healthcare on these quick comments that the other unbelievable wealth is go to the families they know and the patients themselves. They have tons of ideas for you. So going back to who we talk to, physicians and other healthcare providers, phenomenal. Nursing, phenomenal. And the patient and the family, they're your secrets, because they know. Yeah.
Thank you, Dean Delaney, for a fascinating and inspiring talk. As you know, there's a tremendous transformation that's coming up in the world of healthcare, which is the movement of healthcare from hospitals to clinics to home. And this idea of healthcare at home is being driven, by costs and otherwise, but it's being enabled by the new waves of technology, including moving from episodic monitoring to continuous monitoring, all those kinds of things that are possible with wearable sensors and cloud-based data and so on.
Yep.
So I'm wondering if 10 years from now or 15 years from now, most healthcare is taking place in the home, what the implications are for the training of nurses, what nurses have to do, where nursing has to take place, in this future world of digital healthcare at home.
Mm-hmm. Well, that's a loaded question, isn't it? It's a big one. Let's see, I'm going to back up just a little bit. Everything you're saying is, it's massively occurring. It needs to still occur with a speed like we've never seen. And I'm going to make a couple comments. One is with the phenomenal, I'm going to say tools, devices, et cetera, that you're all creating, as well as the related processes. This is really becoming possible. The people, let's put it this way, being in acute care bed's not a destination of choice. Nobody wants to be there. Every one of us want to be home. And why we want to be in that bed, whether it's ICU or the other acute care, is because we know we need it, and our agency is a little compromised here. We truly need deep intervention. So people's destination of choice is to stay at home. The tools that you're all creating, the world is massively open to even more. And then my third, I have two more comments. One is the people. In the United States, our call to action for any tools, et cetera, that we can do to educate the people, you might say the care provider, or create the home environment so basically there's less strain on that care provider or the patient that's at home. It's the care environment, it's the environment of the home. And I know I just said that knowing that there are millions that don't have a home. So just think of the implications for your work in spaces that might be the tent on the street. And so that work is massive. And we already know that as these ICUs come into the home, or the care of the postpartum children that need extra help and the mom, when that's happening in the home, yes, it's happening, but the stresses and strains, I'm going to call our social determinants of health, are not aligned with supporting what really needs to happen in the home. So I have dire concerns. I have a hopefulness and also concerns about it. And then you asked about nursing education. I'm going to spread that out just a little bit more. There is this phenomenal center here at the University of Minnesota called the National Center for Interprofessional Practice and Education. Several years ago, it's probably been about 8 now, the federal government, HRSA, funded one and only one center in the United States, and it was meant to bring together the best of the science and the discussions related to interprofessional practice and education. One of the experiments that they had going on, this was in Nebraska, was when you bring the team of health providers together, and this happened to be in not a home environment, but it was the continuum of acute care and then transfer to home and use of clinic. They had some fascinating discoveries that are a call to action for all of us in the health professions that basically, I'm going to just say 2 points. One was that the licensing capacity that is attributed to each healthcare provider, whether it is a physician, a specialist physician, a regular meaning general, RN, or a specialty practice, nurse practitioners, nurses' aides, every one of those position descriptions changed. And it changed like this. Whoa. A lot of things that, if I'm going to say people that are more expensive in terms of their professional situation, that the ratcheting down of what less expensive people could do and do safely was profound. So basically, I know that's just one test, but it basically called into question, are we going to continue to define the scope of practice, it's called, for each one of these disciplines the same. So we have some hard discussions coming. Now I'm going to come to nursing specifically. I do spend time and encouraging the faculty to do this as well, but we need to speed it up. That the question is, what of how we currently know nursing, other than the relationship, actually is going to persist? So I'm talking about skills and all that sort of stuff. And given all of the products that are available to us, what will nursing really look like? What I'm confident that will persist, but it will also have a massive AI support, because I just made a couple comments, but not really much. The whole AI transformation of everyone in healthcare, and including our population, is going to be massive. So how do you and I prepare for that and hang on to the human wisdom in partnership with the AI? We're confronted with that every day, and I think we always will be. So how do we train or educate people that way? And how do we continue to transform, that's reimagining this nursing education, out of all of this stuff that a chunk of which is required by our accrediting bodies? So this is a big, big question. Accrediting bodies will change last. So what we're doing in the school is pushing the envelope on beyond accreditation. What can we change? But one of the key take-home, while the rambling that I'm doing, is, as I'm circling and circling, is that we're going to see dramatic changes in who does what, and it will be like this. And you know, we already have families doing things that in the past they would have been strictly, you know, RN stuff. But because of the supports that come through these devices and technologies, we can safely have them do it for many families, but not all. So I'm just doing a massive reconceptualization and a change of everything. Then that leads to what I know you deal with too, is so maybe, you know, nursing will disappear, or physicians will disappear, or pharmacists will disappear, and all that. And I don't see that at all, but I see a right sizing of it and how it is that we work in teams. So that leads me to another quick comment. You know how my head goes. So there's a fascinating study that was done by Kristen Will from Arizona State University. She actually performed it here using our large data capacity here through our CTSI. And Kristen, there are just two comments about her study. She did a phenomenal job of going into, if you might say, somewhat structured data, but a lot of unstructured data, and was able to recreate what is a healthcare team anyway in these variety of situations. And it went beyond the traditional situation is the healthcare team is who's getting reimbursed, and you use the reimbursement data to do this. This was real EHR data as well as reimbursement data. So she was able to identify the team, and it was fascinating, including the patient, by the way. It was fascinating through that documentation to see which one or more of the team members actually had impact on the outcomes of that patient, including the patient view. So you can ascertain the direction that went. Only you might have a team of 10 or 12, but probably a couple were making the real difference in the outcome. And it depended, of course, on the trajectory of their healthcare, I'm going to say, episode. Phenomenal work. So that is also redefining how we work together, whether it's in the acute care or in the community, and really being able to trust one another and leverage, instead of keep ratcheting it up, ratcheting it into a sustainable system.
You know, thank you for that comment. You anticipated my last question, which I'll just do it a little bit different way. How many of you, I see lots of students, how many of you are doing big data, AI, or data science here? A bunch here. I thought there may be more students might be doing that. This convergence of, and what a great opportunity we have here as someone that has dual expertise in this area, and also some of your faculty, and extended beyond your faculty. But this is a topic on its own, and maybe next year we'll pursue it some more. But the convergence of computing power, data science, and voice of the customer.
Yep.
What a great thought. And you're agreeing with me, right? Also Netherlands, right? Yeah. So this has been a great session, and I'd like to have all of you thank Dean Delaney